Assalamualaikum dear students, it's Dr. Masma Mehtab. Welcome to my YouTube channel Medical School. So today we are going to learn about the chronic rhinitis and its type. They are hypertrophic rhinitis, atrophic rhinitis and chronic simple rhinitis. So what is chronic rhinitis? It's inflammation of the nasal mucosa, and if it's lasting more than 3 months, you can say that it's chronic rhinitis. So what are the reasons of chronic rhinitis? If there is persistent nasal infection, or something is irritating your nose chronically, or the nasal obstruction like DNS, or we have endocrinal or metabolic factors. Now let's talk about the types of chronic rhinitis. We have chronic simple, hypertrophic and atrophic rhinitis. So the chronic simple rhinitis, it's a very early stage of hypertrophied rhinitis, which is characterized by hyperemia of the nasal mucosa. That means your nasal mucosa will appear as red with the hypertrophy of turbinates and increase in the seromucinous glands and the goblet cells. Now remember one thing, when you will apply pressure, they will pit on pressure. Okay, now clinical features includes nasal obstruction. Because of the hypertrophy of turbinates, there will be nasal discharge anteriorly as well as posteriorly. There will be swollen turbinates and there will be headache. Now, this chronic simple rhinitis can be complicated into hypertrophic rhinitis if you are not treating the simple condition. So what will happen? There will be complicated condition. In this condition, you will see there will be thickening of the nasal mucosa, submucosa, seromucinous glands, periosteum, that is a covering of the bone, and bone. Now, the reasons include recurrent nasal infections or nasal irritations like smoking, or allergic rhinitis can also develop hypertrophic rhinitis and prolonged use of nasal drops. Now, here you can see the turbinate has become swollen or hypertrophic. The symptoms and sign includes a nasal obstruction. There will be nasal discharge and which is thick and sticky. There can be transient anosmia. Now, the transient anosmia is because of the hypertrophy of turbinates. And then the terminal mucosa is thick and it will not pit on pressure. Now, that is a differential point between the chronic simple and the hypertrophic. And it will show little shrinkage with the vasoconstricted drugs. So the treatment of this condition includes cauterization. It is a surgical process by which you just remove the excessive tissues which are not needed. And then submucosal diathermy, again, this is the same process, but by means of temperature, we do that. And then the cryosurgery, partial or total turbinectomy, that is a removal of turbinates if you are removing partially or totally depending upon what you are actually doing. And then the lasers. Okay, then come to the third topic, that is atrophic rhinitis, which is also called as ozaena. Now it is characterized by atrophy of the nasal mucosa. Now you can just compare both of these things, like the hypertrophied and atrophic. These both of these conditions are opposite to one another. Now what happens here? There's atrophy of the nasal mucosa and turbinate bone. Nasal cavities become roomy and wider. Now, foul smelling crusts are also present in this condition. Atrophic rhinitis is basically of two types. We have primary and the secondary. Come to the causes of primary atrophic rhinitis. So it can include the hereditary factor or endocrinal disturbances. Here I can give you an example that mostly females get this condition. Number one, and number two, at the very early age when they are very near to the puberty, and this condition can improve itself when that female undergoes menopause. So this through this point we have suggested that it may be due to the endocrinal disturbances. And then we have the racial factors, nutritional deficiencies like vitamin A or iron deficiencies can also lead this. If there's infection or autoimmune conditions like your immunity is attacking your nasal mucosa, so these can be the causes of primary atrophic rhinitis. Come to the pathology. Now what happens? Your ciliated columnar epithelium is replaced by stratified squamous type. Now here will be atrophy of seromucinous glands. The periosteum and bone will go into obliterative endartitis, and the bone of the turbinates undergo resorption. And that is the reason why your nasal cavity becomes roomy and wide. So this is the condition. Here is the foul smelling crust that you can see here appear in the green. So here you can see the nasal cavity, which is roomy and wide. And this picture, I'm sorry, it's not actually presenting itself. However, I have shown here that the cavity is roomy. So here you can just guess this thing. Okay. What will be the clinical features? There are crust with the foul smell, anosmia called as merciful anosmia. Now, there are crust with the foul smell. Another person can smell it very easily, however, the patient himself cannot smell. That's why it is called as merciful anosmia. Then there will be nasal obstruction due to the crust, and then there will be pale nasal mucosa, septal perforations, and dermatitis of the nasal vestibule. Now, these three conditions you will see when you will crossly examine the patient or physically examine the patient. Okay. So treatment includes the medical as well as surgical. So medical treatment includes removal of the crust, remove the crust and treat the patients with nasal irrigations and estradiol sprays and give the patient or prescribe the patient systemic streptomycin. And the surgical treatment includes the closure of the nostril. Now we have here two surgeries, like we have Young's operation and modified Young operation. Now, before talking about these, first you have to clear the point that why these nostrils are closed, why the surgeons are actually closing these nostrils. So the point here is that if the dry air will enter the nasal cavity, again it will form the crust. So we have to avoid the formation of crust, and that's why we are doing these procedures. So let's talk about the Young's operation, where in this process, what happens? There's complete closure of nostril. However, in the case of modified Young's operation, there's a bit opening left, a very small opening which is left. Now, both of these are same in the treatment. Like this is also useful, this is also useful. But the thing is, the patient will feel much better in the case of modified Young's operation. Okay. I hope you understood very well. Um, Thank you so much. Allah Hafiz.